I ask permission and usually audio tape
Oh, okay.
our like PTA meetings and stuff too, because I'm horrible like with notes because I get caught up in a conversation.
Yeah. No, the YouTube definitely helped.
You can also use I'm the secretary for the Democratic Town Committee. I also use like discussion ensued regarding placement of lawn signs. You don't need to put like Kebby said this and so and so said this. You don't have to include all that stuff. What's really important to include is like what if there was the roll call and if there was a vote for something, then you would say, Kebby, motion to place lawn signs only on main roads by Kebby Waterfield, seconded by Megan Waterfield. All in 25 in favor, 4 opposed, none abstained. Motion passes. Like that kind of stuff. If there's a vote for something, but if there's like a big, long, drawn out discussion, you don't need to like, type out word for word what people said. Like I usually just put like discussion included, conversations about how to reach communities, underserved vaccinated communities.
Right. Okay.
You don't have to don't drive yourself crazy.
The stream is all set.
All right.
Martin.
No problem.
Thank you. All right. So I didn't hear from anyone. I'm not sure if Kathy's able to make it tonight. I did, Dr. Mohammed will not be available until May for April, May for our meetings, but he is definitely planning to come once he's teaching a class. So we're going to have to adjust for the moment to his absence. Can we call to order now, or should we give Kathy a few minutes? I think it was 6:34. I think
you can call to order.
I think we can, yeah. So let's call to order at 6:34 and rise for the Pledge of Allegiance, and thank you for Kebby for the flag.
You're welcome. I'm standing with my camera off.
I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right.
My dog is growling as I'm doing the Pledge of Allegiance. Apparently she wants to also pledge allegiance.
She's contributing.
Shh.
Okay. So do you want to do the roll call, Jean?
Sure.
Really quick.
Heather Shea.
Present.
Kebby Waterfield.
Present.
I'm not sure how to say that name. Marcin
is just running the meeting. He's not actually a member.
Okay, and then it looks like Kathy is absent and Dr. Mohammed is absent. There's nobody else, correct?
No, that's it.
Okay.
And so I did, Maureen, that's what I was going to add. Maureen is also absent. Maureen just contacted me and let me know that she had a meeting at 6:30. So she was not sure if she was going to make it, but I did talk to her. So I thought I would share some of the updates that we discussed today. To bring you guys into the loop of everything that's kind of happened since our last meeting and to continue to the discussion. But, right now there's only 3 of us, so we can certainly discuss, but I don't think that would, what did we say, 3?
I'm pretty sure it's 3.
So we might.
There's only 4 of us or 5 of us. So.
I think that's okay.
Okay, so okay. But we're not going to vote on anything. I don't believe.
Nope.
There's nothing on the agenda to vote on. So, so I just wanted to update. I did send an email with the data with the increase in the percent of residents with the first vaccination, which was up to 21.44% as of the 15th. But there was at least one clinic since then of approximately 200 residents on the 19th. We have another one scheduled tomorrow at Morrissey Manor, and then again on Friday. I have to say the clinic on this past Friday was phenomenal, seeing the residents coming in. There was a lot of our our neighbors, and it was great getting out. And Bridget was a rock star, getting that collecting those names and getting them to Maureen and Mary Kate and Elaine, who really have these clinics running like clockwork. So just kind of wanted to make sure I updated on that. I do have an update on the data that we were looking for, and we do not have the neighborhood data yet. The access is a little difficult. So we have numbers and we have some breakdown, but Maureen reported that she spoke to or with area health departments, and the area health departments have reached out, to the state to kind of request some more specific drilled down data to kind of help point them, in the direction of where they need to get to in neighborhoods and, who aren't getting vaccinated. I'm trying to think what else we talked about. The homebound. Plan was to go out on this past weekend to start getting the homebound residents, and unfortunately the Johnson & Johnson vaccine is not available to the health department. She was notified last week until they thought the first or second week of April. So as soon as we are able to get that really is the plan, to get out to our homebound residents so that way they can, be vaccinated, and it won't, we won't have to.
No, that totally makes sense.
Yeah, it doesn't make sense to have to do it twice.
Yeah, so we're in a holding pattern for that. And I did ask her, just because I had seen the state come out yesterday, and I don't know if you guys had seen it, with their plan of reaching out into neighborhoods, reaching out
that with mobile vaccinations throughout the state. I wonder how that could somehow involve us.
That's exactly my question. And I think she's, my understanding in talking with her is kind of waiting to see more information about that, how that would, because I really think we have a good amount of our population that would benefit from that service. So I would love to see West Haven be able to take advantage of that.
I would guess they would use the mobile emergency vehicle that we have in the city.
Oh, okay. But
I would bet they would use that.
Probably. I guess I was
Mobile Command Center, maybe it's called.
Yep, I can't. Okay, gotcha. I was looking at the pictures, thinking that they had something that they had purchased too, but that might make sense. Just to each individual city would use their own sort of. I don't know. It was some little bus.
Yeah, it could be a combination of. It could be a combination of those things too, right?
But I think it would be fantastic for West Haven, because I think. She also, Maureen also said, and I did not write down the date now that I'm looking at it. They're setting up a clinic with a housing authority at Glade Street, I believe. So that will be coming soon as well. I did not write down the date, and I don't want to guess because I don't want to misspeak. So they're really, I mean, since our last meeting, I feel like we're moving in the right direction. So any thoughts, ideas, based on those
So I
updates?
just got I got a lot of great feedback from the clinic last Friday that you guys held, like, you know, the quick turnaround on getting that set up and filled up, and everyone praised how great you guys were, who worked the clinic. So I was hoping that Maureen would be here so I could pass that along, pass that praise along to her. I thought it was a great job, as well as thank Councilwoman Hosky for organizing that and getting and spearheading those scheduling of appointments, which is such a tough thing to do, knowing from the from the side of the hospital doing that at work, how much of a struggle that is, even with a full medical software database, just to have to, you know, work it through on a spreadsheet, and the cooperation between her and Maureen to get the patients from the spreadsheet into the system. I think you guys did a tremendous job, and you know, getting 200 people vaccinated in a very short time. So
I was
just
very
wanted to say
skeptical
thank
that
you.
that was going to happen. You know, I was like, how in the world is that going to happen? And it just all came together. So,
Knowing Councilwoman Hosky, I knew it would.
yeah.
She was amazing. I have to say, and you're right, Councilwoman Hosky. I was like, how you took this on? You are brave.
I know, like all of a sudden, like I'm like, how the heck? Why is Bridget? I saw a Facebook post and I was like, how is Bridget doing all of this?
And
like
she
I was
did it.
like, what the heck?
Yep.
She said the calls are just coming in, and you know, there were people who reached out to me and was like, well, what do I do? I'm like, just you know, it says just reach out to Bridget. Her information is listed there. And like within an hour, they're like, oh my God, she got right back to me. Like she was so great.
She did a great job. It was a good cooperative effort, for sure.
And you know, I know there was some other activity on somebody else's was reaching out into the community as well. And it just, honestly, all the feedback that I got was from people who were coming and sitting and being vaccinated, just to have people reach out and be there for them and know that, you know, our community is there for them meant a lot. So, yeah.
I think one of the things I didn't get much feedback on yet from our last meeting was the use of social media. Maureen had mentioned that there is a Board of Health Facebook page. I'm not sure who manages that page, or if it would be in our best interest to start another one as the appointed Board of Health, and where we could put out this information, because I do think it's critical that we get this advance notice to people about when clinics are going to happen, especially as the tidal wave starts of everybody being able to get vaccinated. I think having the information out multiple times a week, if not daily, would benefit.
I agree, because I
getting
went.
it done.
Sorry, I didn't mean to interrupt you. I went and I looked on the site after the meeting just to see, and I mean, I feel like we need to have more. To say this politically correct, maybe more informative information on it. I didn't find anything very informative regarding the vaccines.
And Marcin just shared the health department.
He's quick, that Marcin.
I know, and and I saw it pop up, but I know there's a way to access it. I really am technologically savvy, but for some reason WebEx has completely.
It's very different than Zoom.
Confused me. So. I found it. I didn't scroll down far enough. I have it. I just have to scroll down.
So that's the main West Haven Health Department Facebook page.
Okay.
And then also, let me.
And I know there's a link on the. I know there's a link on the City Hall page, right? As well, to all the information. I tend to agree, Kebby, because I run a lot of different Facebook pages for different things, and I think that I can answer, I think, and Marcin, you can correct me, I think Mike Walsh runs the page along with Maureen and her interns, perhaps have some input on that.
I know at least Maureen and the interns.
Yeah, okay. You know, maybe for us as nurses too, as the appointed Board of Health, I think that's a great idea. I think
I agree with that.
To get the information out in a timely manner, because Maureen and her interns especially have their hands full with
Right.
trying to get the pandemic under control.
Oh,
And so,
100%. If
yeah, I think
if
that's,
it's anything that we could do to help
yeah,
take some of that
yeah.
burden off of them, that is within our realm of practice. That's a bad word, but you know what I mean. Like
Yeah.
that isn't making official statements for the city.
Right.
Right.
We're just sharing. We're just sharing information provided to us from from Maureen. Like that. That whole little JPEG that had the info about the last week's clinic.
Yeah,
I had put that together, so
Yeah.
I could.
Oh, really?
Mike sent me the information via email and said, "Could you make this look like an announcement or a flyer?" And I said, "Sure, no problem." And
That's definitely what we need, especially moving forward with the younger age brackets coming through. All of those people use social media. Like, I mean, you shared it, then I shared it, then it
Yeah.
shared, like, you know what I mean? That's what happens. And that's how people, see it. So I think that would be the best thing that we could do,
And
actually.
Instagram too. I guess I'm old, so Facebook is that's where I'm comfortable. But Instagram, the younger generation, definitely. Oh God, I just made myself.
It's funny because we just made a new position in the Seahawks on our board as a social media coordinator, and it's my 22-year-old daughter, because I do our Facebook page, but she'll say, "You should put that on Instagram." I'm like,
Yep.
I don't even know how to post anything on Instagram. Like, I could look at other people's pictures, but I
Yep.
don't know how to. So we need to get some kid to man our Instagram page.
Yeah.
And we just probably need to run it by Maureen, who might need to run it by legal just in case, but I don't see a problem, especially if we, clearly indicate that it is not the city health department.
The official,
the board of health
for informational dates and vaccine clinics and stuff. I think it should be fine.
And that way, if you want to create it, you can also make me and Jean and I should say Jean and I and Kathy admins on the page.
Yeah. Okay.
And Maureen too, probably, if she has a Facebook, she might want to be able to post to it as well.
And I think she has a young daughter too that could also
our proxy posters.
All our children. Could you tell us what we should be doing with this? I don't know. I just think, even TikToks keep things interesting if we,
You can take a little video of you and Maureen giving shots and put it on TikTok.
Yeah.
I don't know anything about TikTok, not much. I'm on it just to see what's going on.
My children
the same thing. All I could do is look at videos, because I found a video of a dog that uses a foot pad to say words. So I watch him all day long.
Oh, that's so fun. Today is puppy day.
He says, "Go walk, play ball." It's like this little, like a thing that sits on the floor, and he touches these buttons and they say words, and he literally can say what he wants to do. It's hilarious.
That's crazy.
Bunny. Look for Bunny on TikTok.
No, I'm actually going to look for that now. So yeah, I think that's actually a good action item that we didn't even talk about last week, is making an action item, but you're right. That should have been, absolutely. We'll do that at the end of this meeting. Do you want to, Kevy, do you want to take on creating the Instagram with your daughter? AKA,
Sure.
Your daughter take that on?
Absolutely.
Because
she'll be thrilled to be a media coordinator for something.
Yes.
There you go.
Just have her tell you, because that isn't something I'm good with, Instagram, but I think that's definitely a place that the younger generation looks. I keep saying that for the information. So, all right, so we'll start an Instagram. We'll start the Facebook page. I told you about the next clinics. Oh, the volunteers too. And I know, Jean, you had asked. Elaine Holman is the person. Did I send you the, I can send the emails if there are people who are interested in either the paid positions or volunteer. Right now, I'm unclear of how much is in the budget for paid positions. And like I said, and I've said to Maureen, I'm just volunteering. I'm grateful to have a job who lets me take some time off to do this. I just want to get out into the community and do it. So, but I know it's important for some people to be paid, but send the information to Elaine. And
See, that could be one of our first posts on our Facebook page.
Exactly.
yeah.
Exactly.
And we should be getting more COVID money, so that might be something that we can utilize, or Maureen, I should say, can utilize. You know, obviously she's in charge of her budget, but it might be something she wants to utilize to get more, depending on the number of vaccine doses that she gets, because obviously we don't need
what it depends
a
on.
ton of volunteers if we don't have any doses to give. So
And that is the limit. You know, right now we have a really dedicated group of people who are showing up pretty much I want to say like 7 or 8 of us. There's 8 stations, and there's probably about 10 of us that, you know, because a couple of us can't do certain days, but are just always there. And so we're able to get 200 pretty well. But if it gets any heavier, And
well, and as the age groups change, I think we may also have to change or alternate the hours of operation, because I do think that it's going to become critically important to do evenings, you know, early evenings. I'm not talking like till 10 p.m., but like, you know, with the Yale clinics, we run them from 7 a.m. to 7 p.m. Monday through Friday, Sunday to Sunday. And I think that, you know, we are going to have to probably think about, and again, I defer to Maureen. Obviously, she runs the department. I don't in any way want her to think I'm trying to overstep my place, but I think it would probably behoove us to think about alternating with some non-traditional hours to reach more of our population as we move forward, if we can.
And one of the things that I was thinking that we could even ask Maureen is if, especially when we get to the 16 range, is that something with your other hat, Kevy, that even coordinating with the Board of Education?
Oh, absolutely. And I think Jill and Marissa are a great resource at, you know, but you know, that could be it too. Like there may be you know, an opportunity to do a clinic at the cafeteria at West Haven High School, or the gym. They're using the cafeteria to make lunches now, but maybe the gym at West Haven High School one Friday afternoon or one Saturday morning, or, you know, some kind of, you know, to get at least those kids in there. There may be a lot of folks that are leaning more towards their pediatrician's office. I don't know how.
Are they going to be?
I mean, I certainly am going to get my kids vaccinated as soon as an opportunity pops up. But there might be more people that want to speak to their pediatrician directly before doing it, and maybe thinking about getting that at the office. I don't even know if they're going to be able to.
That's what I don't know.
They don't know.
Nobody can
the
give.
Pediatrician's office like posts every once in a while on Facebook and does like Facebook lives, and said that they have no idea. They put in to receive the vaccine to administer it, but they have no idea yet from the state if they're even going to have it. But also too, the school has a new like health. I'm probably speaking incorrectly, but it's like a health center.
It's correct. It's a health center.
Yeah, and so I mean and I think that they have a nurse or an LPN. Not that I want to add that to her, but maybe something, you know, can be coordinated with that as well, somehow. I don't know.
And is that run, Kevy, by one of the area clinics? Like, is it Pro Health, or who runs that? I know.
I think her. To be honest, I'm not 100% sure. It's my understanding that it currently is run through the school nurse at the high school. Okay. But they have, you know, it's not the old school nurse's office anymore. Like they have actual exam rooms and, you know, a waiting room, and it's a really nice setup. Once we're all vaccinated, I'd be happy to give you ladies a tour of it. Once we're back open again. It's a gorgeous setup, and
they could do anything. I mean,
physicals. They can have well visits. They can have sick visits. They can get a lot of stuff done in there.
Yeah, I'm hoping that as this rolls out, that would be so perfect to have the health department work with them to,
Yep. And again, Jill would be the liaison for that, and she's fantastic.
that's what I've heard from a million different people.
Well, I'm glad to hear that.
Yeah, I've
I'll
heard
pass
that
that
from
along.
a lot of different people. So we have a lot of ideas, definitely. I think the biggest thing come away from now is still keep working on that data, for sure. Trying to get the neighborhood data, because I just think we need to know where we need to go and help educate, answer people's questions, to answer, what are they concerned about? What are they, we have had people come into the clinics, I have to be honest, and say, is there a chip in here? Like, very serious, very, I mean, people do hear these things, and, especially, if they're older, they believe it. So they need to know the real, information. So we just need to know who we need to get to help.
And there's lots of stuff we can post directly from the CDC, which would be approved content,
Yep.
I
already.
think the social media is the biggest thing that we could do, like, totally.
But I just keep
all of that
back
stuff.
to the people who don't have technology. How can we reach Jean? Your reverse 911, Joe, you had suggested, is great, because Joe Soto does have that.
That might be better once we get into the everybody range.
Yep.
Because I did not think about how it would affect, like, all these people are like, okay, I want to do it, but they're not in the age bracket. So, like,
Right.
once they open up the gates
Anyone.
for more people, once we have it all set up, let's say, doing a reverse 911 could be for some of those people that don't have social media, and say, these are the dates, these are the numbers to call. I mean, I don't know, it's worth a shot.
Yep. And this past weekend, I mean, we could and should, once we have this up, this past weekend, New Haven had 400 doses available that they accepted walk-ins. I mean, these are neighboring communities. So if things like that even happen in neighboring communities, we can get that information out.
Definitely.
In a quick way.
But you have to also remember, there's a lot of people, even if they don't have social media, they have family members that do.
I have social media, they can make the call. That's true. That's true.
So, I don't know. I think that's our biggest, I know I said it already, but that's our biggest.
We'll do that today, for sure. What else? And that way, I mean, that's it for the minutes. I apologize. We need to, did you get a copy of everyone here, get a copy of the very first set of minutes? And because we did not vote to accept the minutes last week, I'd like to just ask if...
Oh, the very first, like when the mayor was there?
Yes, the very first set of the minutes, and last meeting's minutes from the 9th, if everyone had a chance to review those, and if anyone wanted to make a motion to accept those.
I'll make a motion to accept the minutes from both meetings.
Thank you, Kebby.
You're welcome.
You'll
have to second, because I think Jean, since she wrote them, probably.
I second.
I don't know how that works.
I was looking to see. I will absolutely second. I don't know why I skip right over that into the discussion. So the only other thing that I had on the agenda was any new business, but I think our old business for now seems to be really where we need to focus. Is there anything else we haven't talked about that we need to discuss? No?
I can't think of anything. I think, just like everybody else, like our focus is COVID, COVID. So,
and getting the shots in the arms. Yeah. All right. So I think I will take a motion to adjourn.
I'll motion.
All right. 7:01. Thank you, guys. Thank you. And I'm going to go set that up right now.
Excellent. Are we still streaming, Marcin?
I'm going to shut it off in a second.
Okay.